Okay. And so my name is Augustine Kibala, like the MC briefly introduced me. I am from Liberia, West Africa. I have I'm a Christian. I have a bachelor's degree in zoology and minor in chemistry from the University of Liberia. Then I went on to medical school at the Hebei University uh, here in China, in North China. Uh, Graduated from medical school, graduated from University of Liberia 2010, and then 2011 went on to medical school here in China on a bilateral government scholarship, then graduated 2017, went back to Liberia, did my exam and internship, got licensed and worked in Liberia for 2 years. Then I came back again to China 2019 to do specialization in neurosurgery on the sponsorship of the World Federation of Neurological Surgeon. So I'm currently at the final stage of my specialist training program. Hopefully September, then I'll be going back again to that small country that I love. Yeah. So today I'm going to be presenting our general topic for the entire medical conference is volunteering globally on a medical mission team. So the two keywords we're focusing on was volunteering and then medical. All right, so we're in a medical thing, but it's a lot. We're going to have other speakers talking as well, not just saying it's a team, not just medical people can be on that team. You're going to have non-medical people as well on the team. You're going to have other professional people on the team. And so the intent of this, one of the objectives of this conference, one of the major objectives of this conference is that we at ICMFEL, the International Christian Medical Fellowship, we're planning next year, 2024, to do a mission trip, medical mission trip. So one of the aims is to get mobilized people, know about that, and those who are interested in that kind of venture to join. And also, we don't want people to be ignorant to go, because there are disasters there. Instead of you going to help, or instead of you going to really enjoy what you're going to do, if you don't know a lot about that kind of mission, you could probably cause more harm than good for the people you're going to help. One, or even you yourself, you could cause some harm for yourself, or even get discouraged. Or it's not good to be ignorant to do such a thing. So that's the second purpose is not just to mobilize people, it's also to give that information, educate people about such kind of thing. So I'm going to be talking more about the medical aspect. As a medical professional, how can you volunteer on a medical mission? So I'm going to be bringing in a little bit, a lot of examples around from Liberia, so that was a Liberia case study, right? So I actually want to look at 4 different aspects when it comes to volunteering as a medical professional. So one, the aspect of human resource for health. And then that is, what is the skill needed, what you need to be to actually, venture into such thing, right? Where you're going, are you really needed there? Do you have that kind of skill to go there, right? Is this the kind of people needed there, right? Be you a medical student, will it be, will your venture there be useful? The kind of, is it the gap is really there that we can go you be a blessing there, or you will also really, learn a lot, right? Because there are certain stages that we really can want to volunteer. Now, as a resident, I know when I'm a medical student, there is this big yam. You want to just get into the hospital. If you're the kind of person who have passion for surgery, you want to just be in the OR, like you just want to do surgery. You don't know how it happens. Like you just have so much, desire and passion. And so medical mission becomes one of the things medical students will be excited about, because like, oh, I'm not going to learn something. I'm not going to be able to really touch patient without able to. So you have that phase. I'm talking about medical students who have passion to be doctor, not just because it's a different category of medical students, right? Yeah. So that's one. Another stage is when you are quite a young doctor, you don't have a lot of experience. You want to venture out there. You go for all opportunities to venture out there. There's a certain stage in your medical profession as well where you want to go for that area where you want get money or be relaxed, a career person. You not just want to do any kind of volunteer thing anymore. And then certain time when you retire. So there are different stages. But the concern when it comes to human resources, they're going to be emphasizing on this. Where you going, and you as an individual, what is the essence of that aspect? Are you needed there, or do you have the skill as well? Then infrastructure, right? There are a lot of infrastructure as well. You could have skills, but if you go somewhere to volunteer where the infrastructures are not there for you to volunteer, it becomes insignificant. So I read a report about medical missions. They went with cardiothoracic surgeons, they went with neurosurgeons, and pediatric surgeons, and they went in a remote village. No theater, nothing there. So these people could not do brain surgery, heart surgery, where? So they were just there. There were no infrastructure, right? So that's the second aspect you need to know. When am I going? The skill that I have, they have the kind of infrastructure. And then culture. This is very important as well, right? Many times we go a lot of excitement, but especially when you're coming from another culture, going to another culture. You're coming from Africa, going to India, or going to Brazil, coming from, Brazil and Europe, coming from China, going to Africa. This is a really big cultural gap. There are a lot you need to know about that before you go into such area. Then the system as well. What are the setup there? So these are the four things I want to talk about quickly. So first of all, human resource for health is defined as a human resource, health human resource, many times also called human resource for health, is the health workforce in totality, right? Everyone that is involved primarily is something or work that is intended to enhance health, right? So that's the definition given by the World Health Organization. So that include physicians and let me get this correct. So physicians, and the doctor, the nurses, the midwife, dentists, allied health professional, community health workers, everyone, I mean, in totality. So even in terms of the hospital setting, cleaners, yes, the administrators, the accountants, everyone, once you're doing a work kind of tied to, now even in many hospitals, we have legal people there, because like in China, the practice is really strict. And I think it's kind of related to some other cultural issues as well. Medical legal is hard, even though the authorities may know that you did everything well. They stay, if the patient expire, they're gonna take the doctor to tax, like you kill the patient. So now many hospitals have legal system as well, right, to make sure if there is any case of medical legality, and you have a legal person to represent the medical team. And so now it's very key, right? Nothing probably many years of one child policy. And so it's not going to be easy if my only child is fired, especially in pediatric, they be having this that kind of thing, right? So maybe the doctor did everything, but I want to know why. Like, what did I have to die? And so medical legality become issues, right? Sometimes the patient relative will just be hard. And so all of those people are part of the human resource for health. So you could be a legal person where you are, or health workforce as well. That's the point I want to make. Also, so I want to give a picture of Liberia, talking about human resource for health, and I'm using Liberia as a case study. According to the recent statistic 2022 from the Ministry of Health, they have like 5,000 health workers. That includes the nurses, the physician assistants, and the air security cleaner in totality. That's recent. Doctors in 2015, the statistics from the Liberian Medical Dental Council, in 2015, it was 298 doctors in total. Recently, they have increased from medical school with the now have a specialist training program, postgraduate training program. It has increased. So the recent statistics that we're able to find, it says 924. That's like a right? But that includes as well foreign doctors. So there are a lot of foreign doctors in Liberia as well. Like when the statistic before 2015 came out, there were that great gap of needs for doctoring in Liberia. So a lot of doctors, foreign doctors, were going to Liberia to work. So just even the 298, that included foreign doctors. Just Liberian doctors were now 200 at the time. And so a lot of foreign doctors came in. So even the 924, the postgraduate training program, there are a lot of experts as well from Nigeria, from around the world. The training doctors, they are foreign doctors. So that increase is not all total Liberian doctors. So just the Liberian doctors, we want to consider the doctor to patient ratio is still, the gap is still very wide, right? Specialists of that total, the current statistics say there are 110 specialized doctors, according to the Liberian College of Physicians and Surgeons 2023 report. 110, and out of that 110, I single out neurosurgery because I'm a neurosurgeon. Currently, only one in that country, so hopefully they're going to have the second one this year. Once he graduates in September and return there. Yeah. So doctor to patient ratio, according to the 2015, was 1 doctor to 15,000, and the recent one says little better, but it's still that high. And WHO is saying you should have 1 doctor to 1,000. So you can see the gap, right? So I want to look at what is infrastructure and things. So there is research done that kind of categorize my timing, please make sure. So there is a research that was done in 2006 that categorized the different infrastructure in terms of what it should be like and what it is in developing countries. And they use a couple of characteristics to be able to define that, like the actual location of the infrastructure, is there electricity, is there clean water, is there physical structure, then the staff. And so with that, infrastructure is placed in 4 different categories, where there is actually no infrastructure, like nothing there to really look up to. And that means it's like either most of the medical treatment is done in community or in homes. All right, can somebody help me check charge of clock? I think it was removed. Sorry. So when there is no infrastructure, or that is where most of the thing is done either in homes, and electricity is not available, no clean water, no infrastructure, all the staff are not trained, and there's no infrastructure. They have location like that. Minimal infrastructure, there could be clinics, like in many African region, there are rural health clinics, like in many Asian countries and Latin America. Um, Electricity is not reliable, it's not stable, not reliable clean water. Laboratory may not be ready to stand up, but you could have a little one there. You could have staff, but not very trained. That could be another example as well. So you could also, then we go on, that's minimum, then when you go to moderate, there could be hospitals uh, and urban clinics. Electricity is available, clean water is available, but then laboratory could be poorly equipped, and then staff will not really many specialized expertise. Advanced, you have hospitals, you have stable electricity, you have clean waters, you have well-equipped laboratory, you have nurses, physicians, and well-trained technicians, experts. Then that's advanced, infrastructure. And so, what am I bringing this out? If you're going to volunteer as a medical practitioner, you need to know where you're going. It is an advanced infrastructure, moderate, minimum. Most of the time, volunteering is done in where there is no infrastructure or minimum infrastructure. Usually in the advanced infrastructure, things are intact there. Yeah. So most of the time, the greater needs is in no infrastructure, minimum infrastructure, sometimes moderate infrastructure areas. So this work also categorized where the greater need is like Africa, Asia, and Latin America. Greater needs there. So most of the medical volunteer missions, targets those areas. So access to infrastructure like in Africa is like 25%. In Asia, most of the area, Latin America. So you can see the needs is great in those areas. So for 16, most of the health system around the world is your primary, secondary, tertiary, hospital system. And Liberia have this similar kind of one. So we have primary health care, secondary health care, and tertiary health care. So our primary health care is like clinics, then the secondary health care, we call the health centers, and then in tertiary, these are the regional and national referral hospital. And we have a system that most of the services at the primary and secondary healthcare levels, government says free because not many people can afford hospital bills. So government make it free, but that free has its own challenge because most of these centers then centers not raising money from patient care that depends on government subsidies. And most of these hospitals or clinics and health centers that are declared free by government do not really receive the amount of money needed to run. So the infrastructure is not there because they don't have the money to put into place. And they can't take money from the patient because government says it's free and the government is not providing the money. So it's yes, they're free, but the infrastructure, the service is very, very poor. So that becomes a very great challenge. I wish as free as it is, it was equipped. So this is an example of primary health care, like a clinic. You have 4 to 6 staffs. And so you have a nurse or physician assistant there. Usually, no doctor. The head of the kind of center would be like a physician assistant. Sometimes a nurse, we call them an officer in charge, ORC. And this kind of clinic cover like 3,500, 12,000 area. So usually they will run from 8 a.m. to 4 p.m. they close. So any emergency at night, usually not finding one day. Yeah. So then secondary level, these are like the county hospitals and health centers as well. So at least these kind of centers should have 14 staff. Usually you have a doctor or physician assistant as a head. So this kind of center will cover like 25,000 to 40,000 and they usually run 24 hours. So at least at the secondary level is a little better. And county hospital will have like, cover like 2,000 population area. So at least the county hospital we have like, 50 beds hospital. If it's less than 100 beds, at least you should have like 93 staff. Usually a doctor is the head of the hospital. If you have like 100 beds, more than 100 beds, you have 149 staff, at least a doctor is the head of the hospital. So this is an example. This is actually a private health center. This is another private health center. This is in Morovia. It's in Joseph Catholic Hospital. This is probably what is an example of a hospital, like a county level or hospital. Then there are also a lot of private center. Like now we have, this is the most equipped, I would say, diagnostic center we have, at least where you can get an MRI or CT scan in mammograms in the capital. And so this is an example of a county level hospital. This is in one of the counties. This is the regional hospital. So this is the tetra where you have specialists in all the different departments. And this is also one of the regional referral hospitals that meet there. Just I think at the time I was an intern doctor. Yeah. So there have been a couple of medical missions that I've been privileged to be a part of in Liberia, especially when I developed interest in neurosurgery. So this was one of our medical missions in Liberia. This was 2018. And this is the Liberian neurosurgeon. And this is a Nigerian neurosurgeon. I was part of that mission. So this is at the regional referral hospital I just showed in one of our counties, and this is an American neurosurgeon. It was actually a medical mission over there. Yeah, and this was 2019 as well. This was in Morovia, the regional referral hospital. So recently I was in Liberia as well. It's 2022, and on another mission, I'm privileged to be a part of that. So there is a Canadian mission team that's really supporting neurosurgery in West Africa. And so one of the benefits of those missions is that at least they don't just go with human resources or health, they are concerned about infrastructure as well. So like we were saying, if you don't know what is really needed there, it becomes difficult, right? So they go, they see infrastructure, they see human resource needs. So now most of the time they go for the missions like for them, their focus is on neurosurgery. So they were able to bring a microscope, they were able to bring a C-arm. So the only neurosurgeon now is not just human resource thing. He has a little bit of infrastructure. You have an operating microscope, you have a C-arm and stuff like that. This is operation room service. These are what hope to get you in Liberia one day on a mission trip. So lastly, I want to emphasize on this before I take my seat and take question. Culture, language, food, and cultural differences. Like I put this, there are many cultural issues, but I took those three to kind of just highlight that. Language. Somebody asked me one time, how do you manage in Chinese hospital? How do you manage? Like, I speak Chinese. Like, oh, okay. I think that's a little bit. So that was just my answer. Like, I speak Chinese. So you can practice in a Chinese hospital if you can speak Chinese. I think it's going to be very, very difficult. Yeah. They agree, your colleagues, even if you're in Shanghai, Beijing, one of the top hospitals there, I can tell you most of the top hospitals in China, the doctors are quite good, speak good English and everything, right? So your colleagues will, but your patients Chinese in China. So if you want to really practice and get to that language becomes very, very important, right? So many times I build very good rapport with my patients. So I'm just giving you an essence, like because I'm African practicing in another culture, right? And it's very wild, right? And so many times, like maybe your patients say, hey, what going on? And then they just go down, we start a conversation. So just agree that, a patient like, hey, here in Isha, and I don't even know what they're talking. Maybe I'm just thinking that patient going to be even more anxious, even more, like, so, but I usually change the scene when I speak Chinese. So when I rounds and like, so the language changed a lot of things around there. So if you go for a medical mission, whatever you go, I think language is quite very, very important. Understanding, like, the interacting with the patient. Language is very, very key. Food, you may be going for just a week or maybe 2 weeks. So you may be like, well, that's not really a big issue. I can hang around stuff. But yes, that could be something. You could get diarrhea 1 week and that's disaster. Right? So you have to know the kind of food that's there and what you got to learn to adapt, put it that way, if you want to. So these are things you got to run into your head, right? If you can't adapt in science, you can't adapt, you die. Yeah. So it's key. If you from science background, adaptation is physiological. It have to happen. So if you get to an environment as a living thing and you can adapt to that environment, you don't have to be taken away from there. If you or else if you stay there, you're gonna die. So food is one of the key aspects of adaptation. Yeah. Cultural differences, there's a lot of cultural shock. And many times people go into, especially in the developed countries, right? On one of the mission team, and the Canadians, American, African. So there were a couple of things I was like, not one of the decision maker on that team, just one of the ordinary volunteer. But these are some of the things I have picked up in that if I'm heading in a medical mission team, this is one of the things I would emphasize a lot, right? So not because you're from America, you're Canada, in Africa, like me, everything. Like I saw non-medical professionals on the team, right, who want to be giving doctor instructions, like. So in certain culture, people respect status and reference and stuff. And so yeah, I saw resentment. I saw different attitude from nurses and other locals were like, what is Canadian want to prove? Like we're doctors, we're nurses. Like, why you have non-medical people telling us what to do? Like, is it because they came to help? Okay, they don't want to say some things to make them feel terrible. Oh, we came to help them, they are grateful, but you get that resentment, right? So I think if you're on a team as a doctor, behave like a doctor, right? If you're a doctor, like you take care of your patients, you can start acting like the administrator of the hospital, not because you want to help. That's a lot of things going in between there, right? So if you are a nurse, yeah, relate to the nurse. You don't only respect the foreign doctor that you came with, like the local doctors, like that's terrible, right? So cultural difference, you have to know what respect is. In every culture, respect is kind of defined differently. But respect always becomes respect, right? In Chinese culture, respect is defined differently, but it's still respect, right? In the African culture. So you have to know that these are very key things to pay attention to as a doctor, as a professional person. You will definitely get shocked as well because the way the respect, especially if you're in a different culture, the definition of respect, their relation of respect will be different than what you may usually know. But yes, you have to keep that. So you get cultural shock, but you have to be ready to adjust and prepare for that. So these are very key with that, basically. So I'm gonna stop here. Guess my time is out. All right. So final thoughts. Some of the things that, with those things in mind, some of the thoughts that happen where the needs are. Some of the way people go to do medical missions. Medical professionals, mobile health care is one of the key ones. The medical mission I'm talking about. So there is something they call task shifting. So looking at all the things I just said, human resource, infrastructure, the system, there are places where you have not completed lack of everything, but there is a great need for certain specialized treatment, right? So like you have low-level professionals, like you have doctors who are not specialists, but there is greater need, for example, neurosurgery or cardiothoracic surgery or ophthalmology, art series. And so what they do in those places is like, okay, we don't have all the specialists. We train these local professionals to do specialized things. And then Liberia, there was a time they started doing that, like there were high rates of maternal and maternal mortality, like pregnant women and children were dying a lot, and so they started training nurses and midwives to do basic obstetric surgery, like do cesarean sections, take care of this. When a doctor should do that, not nurses, but started training them. I remember as an intern, actually a medical student, 5th year, I went home for internship. The hospital I was practicing in, the nurse, the midwife, that was very good, do all those OB cases, do CS. That time I didn't even know how to do CS. So I was the doctor, the medical student, but she was like, doing everything. And I wanted to learn. Even though there were times she'd be like, hey, just a year from now, you're going to come here and be like the doctor. So now you're a student. I'm going to train you. I'm like, yes, I'm a student. Just get this. But yeah, but now they have a lot of specialist OBGYN. So that training is fading out, right? But stay in the rural areas, they have nurse, midwives that are trained to do these basic surgeries as well. So this kind of opportunity also becomes a great need for medical mission where specialized people can go in those kind of places to help. Because if you train a low level professional to do a specialized kind of procedure, there are complications, there are risks that they can manage. You need medical missions and people who are vast in this kind of area regularly to kind of be able to get in and provide training and even help those kind of places. So medical missions help with a lot of that, right? Mobile clinic, like the place where you have no infrastructure at all. So many times medical missions can be helpful in this kind of thing. So thinking about medical missions are professional medical people. These are things you can think about, either mobile healthcare thing. We have a few minutes to discuss that together and start. So usually this is an example of yeah, so usually 6 person, you have an equipped car, you have a doctor, 3 nurses, a lab technician, you have attendants, you have a driver, and you have a laptop, a GPS on the 6 person. You can get an equipped car, you can go far remote area. So these are, or you could go for a bigger medical missions, like you saw in the picture of a neurosurgery and stuff. So basically, this is an opportunity we want to share, and we are planning, like I said, 2024 to be hitting. Later in the evening, we have a sharing from somebody from Brazil to talk about the medical needs there in the jungle part of Brazil. Right? He usually call it the jungle part of Brazil. So he's been talking about that. And then I will be in Liberia next year. Hopefully, maybe we'll organize a medical mission there in line with our third international medical conference. So I have a slip in all of your pack. You're interested, they will say it's going to be a team. We'll have people talking about the non-medical aspect, the support staff aspect. You can put in your email there, your name and stuff, so we'll keep you updated. You could be, from this conference, you could build desire, you could want to explore and adventure. Like, okay, I think I know, pay attention to the culture, yeah, know what I'm going to, what skill do I have, what kind of system am I going to? I think I want to go and see. I want to go and help. I want to go and learn as well. With that, with the knowledge from this conference, if you get interested, we'll offer you to sign up and we'll keep you updated. Maybe you could be part of our mission team this year. Thank you. So we're going to do, especially for those online, we're going to book a section. Actually going to be open for, I'm going to make it like a question for an answer because I've talked a lot already. And so the next 15 minutes will be you to talk. It could be a comment, it could be a question, so we can be able to go through the discussion. So those online can raise your hands. There is an icon there. We'll be able to recognize you, and then we can reach to speak as well. So those present as well can take part. When our session is supposed to be ending, Johnson? 10:15. So now okay. Okay, we still have a couple of minutes. So yeah, impressing any question?
Heard first speaker. So do we have any question, especially on the volunteering as a medical professional for a medical mission? So using Liberia as a case study, small nation, a low income country. So we look at the scenario, especially when it comes to the four interdependent aspects that are needed for that mission. Question. Okay.
Thank you so much, Dr. Ballard. I am Sudwe Ibrahim from Liberia. And I listened to you making some very good points. And my interest is in taking into consideration wanting to go on a medical mission or having the thoughts of carrying out a medical mission in some remote settings. How are you able to come up with the medical needs of those persons? Because I think if we identify the needs, then we start looking for the workforce that can be able to implement that need, and we start looking at the infrastructures needed to implement what they need and start working around the system. So how are we able to identify the needs of those persons in those remote areas before we run the mission?
Okay. Yeah, so that is why I think emphasize that you need this kind of conference. So if we say we want to go to Liberia, we should be able to first of all have information. What is it like, right? You just jump one day and like, oh, we're going to Liberia. We say we want to go to Brazil. So we can just jump, oh, we're going to Brazil. So we should know what the needs are in Brazil. And that would better come from a local, right? So I kind of feel like I have the authority to talk about Liberia health system because I'm a doctor and I'm from Liberia. I have practiced there as well, right? So I can be able to highlight what the needs are in terms of from human resource to infrastructure, and I can also be able to caution systemic challenges as well as cultural awareness, right? So that's one. So you need information from a local contact, right? And it could come from conferences like this, right? Probably if you have never been to Liberia, if you don't know anything about Liberia, you probably so you probably be able to from this presentation have an idea of what it's like if you want to go to Liberia. So information sessions are quite important to know, right? And the second aspect is that apart from information section, you get from information session you could get a basic, but going there, you know, if you go for your first mission trip, there are some things you capture by yourself that you won't get from on the information section. Yeah, so that's it. So I would say first of all, information sessions very important. So that's one of the reasons, like I said, from the initial stage, that one of the essence for our conference today. So the fact that we're planning medical mission, we don't think we should just do it. Encourage that people who've been very excited want to go, but we don't want to just carry people who don't know nothing about what they're going to do, right? So information session provide a lot. It will even guide you like, I was interested, but I'm not interested anymore, right? I go like, oh, I didn't see things like that, but now I'm interested, So information session, number one, I will put it that way. And then secondly, on hand, like in-person experience can be a lot to do. I don't know if that answers your question.
Thank you. Any other question?
Yeah, follow up.
Let's say you're a medical student here, you have the passion, you have the passion, you have the interest. My question is in relation to the accommodations, finances that would cover, or the finances that would not be covered, and the budget that you have to for these type of groups? So let's take Liberia, for example.
Good. Yeah, very good question. So, for example, this information section, I will put it that way, this conference, did have financial credit, right? So what we're doing as an institution or as an organization at ICMFEL, so we are looking for sponsor voluntarily. So like this conference, we're organizing the conference. I'm just using this conference as a run to just give the picture of the pattern that's going to be used or that the pattern that is used. Okay. So we calculated the budget to have this kind of conference if we want to get medical students, the doctors, or people who are interested, Christians and non-Christians in medical missions. What would be the budget like? And we came up with this, and we shared that with institutions and people who have the heart for it. And so the reason why we didn't have registration fee for this conference, feeding for this conference, because sponsors cover it. So there's assuming we didn't have any sponsor to pay for the conference hall, to pay for food and everything. If we really still wanted, then we were like, okay, we want to have this conference, and this is the budget, this is what we got to do. So we couldn't raise enough money to say, well, if you're coming from another city, we transport you and accommodate you. So we have to communicate that. So those coming from other city wanting to attend this conference have to accommodate themselves, have to transport themselves, but they have to pay conference fee because that are the basic plain things like sponsored by people. So when it comes to medical mission, we're also going to do that. So there are aspects, right? You have the human resource, like the skills, and most of the time coming from the medical professional aspect. If I'm a doctor volunteering to go, that's huge. I'm giving already, right? So many times organizations that are doing this kind of a sponsor, and once we can raise enough cover accommodations to cover your local expenses, we will definitely do that. So to make sure you go. Yeah. So if need becomes like, oh, we can cover every other thing except transportation, then get your flight ticket. We communicate that. But we look for sponsor. And we not our stars even with that during like fundraising, like no, we do communicate it and we share it. We want people. It's like a passionate thing. So this kind of conferences, this kind of thing is not one of the popular kind of conferences, I will put it that way. So usually when you have conferences, like for example, this kind of conference should be right. Yeah, but I can be deterred many times when I have meeting like this and I don't have like very large crowd. Like my concern can be what the number of people I'm having, are they people who are interested, have passion for it? That's it. So if we have a team of even 10 people going for the medical mission, but passionate, ready for it, that's the impact, the result will be great compared to having 25 people on a team that just want to go for a tour see another country. So what am I saying that is that the sponsors and those who want to be part of the team got to be people who have passion for it, right? Because if I have passion for it and tell me, well, we're going to take care of accommodation, we're going to take care of your feeding, we're going to take care of everything, just get a ticket. If I really want to, I will raise the money for the ticket if I can, right? Yes. So, but in short, to answer your questions, as an institutions, we're going to look for sponsors to cover basically most of the thing we can. And then those on the team, if there is a gap, then we communicate that. That's the pattern we're going to use.
Thank you very much. I think we can. Is there any question for them? Follow on or the main question?
Thank you again. Yeah, so given that we are able to get all on the path, I'm also concerned about how we tend to, or you might tend to evaluate the success of what your mission is or your mission was, and if there are issues for more complications. Let's say we have targeted our mission is to be here in 2 weeks, and after 2 weeks, we experience that we have a high burden of those complications, and we have like more persons enrolling into our service, or we have conducted the surgeries and they are like, you need to do some follow-up or referrals. How do you go about?
So that's why we going more like we're going as a workforce, I would say human resource. So you need to get connected wherever you go about institution. So if you see here, again, workforce, institution, and cultural assistant. And so you going like a workforce, you need to definitely you need to get connected to our institutions, right? So you can just go, especially if you're doing such conditions, you can just go and do surgery and go, right? Actually, post-op complications come and post-op care is also very important. So usually you should be able to have a very strong collaboration with a local institution. Yeah, institutions to do that. So that even once you're there, post-op management is done. And even when you're away, you have a local team that can be able to continue post-op management. And where challenges is, they can carry experts, they can continue communicating with the advancement in technology now. You can have online consultation as well to continue post-op management, stuff like that. So basically, you shouldn't go to a destination for a medical mission without having a local team or local institutions connections, because you should be able to do that. So that goes in a couple of ways. One, you have medical local institutions that you connect with, and in terms of saying it's a Christian medical mission, most of the time you should have a local church or local institutions to connect with as well. So these are also part of the process.
Okay, thank you very much. I think we are in out of the time of the first session. Thank you, Dr. Bala, and for the presentation. Okay, so we're going to our next presenter. I think that Mr. Timothy Mutu is on. Okay. So we thank you. Okay, at this time we will have our second presenter, Mr. Timothy Mutu, a Canadian engineer, entrepreneur, and co-founder of the non-for-profit organization H2O for All. You'll be speaking to us on volunteering as a non-medical professional for a medical mission. As you heard earlier, this mission is not just only for medical professional, not only for allied health professional, but also for others. So briefly, we will introduce Mr. Mutu and then give him the podium. So Mr. Mutu is a Canadian engineer, entrepreneur, and co-founder of the non-for-profit organization H2O for All. With a master's degree in public health and a bachelor's degree in chemical engineering, he has worked as a licensed engineer in the water sector across North America, impacting millions of people in urban cities with innovative technologies. Co-founding H2O for All, he focuses on restoring water, hygiene, and sanitation in developing countries. Tim has worked directly with over 100 rural communities, implementing sustainable practices and technologies in 12 countries. He has received recognition and awards for his work, including Grand Challenges Stars in Global Health Awards, and actively engages as an engineer mentor, and partner with organizations like Engineers of Tomorrow and the United Nations University for Water. So we are very blessed this time to have with us Mr. Timothy Motu, who will be sharing with us briefly. Thank you very much. You're welcome. You can unmute and also share your screen.
Wonderful. Thank you.
Okay.
Thank you for having me. I just need to be able to share my screen. I think a setting has to be changed so I can share my screen.
Okay.
But I'm excited to be a part of this wonderful conference and to come and share about my perspective of a professional, non-medical professional doing work in a lot of medical settings around the world. Oh, there we go. Okay. Thank you. Can everyone see my screen now? Yeah. So let me begin. And again, wonderful to be with each of you joining in China and around the world. I want to walk through in the next little bit, and then maybe we can have some discussion after, how a person like me, an engineer, ended up starting an organization that's doing work all over the world and doing work in medical facilities, hospitals, clinics, all sorts of different medical maternity wards. And I kind of wanted to walk through that journey and then also talk about this opportunity for non-medical professionals to take part in a medical mission. Because I'm not a medical professional, even though I do have an engineering degree and a recent master's of public health. So I wanted to tell you, this is my family. As I was growing up in Canada, I dreamt of the day that I would have people that I would consider family members around the world. And I can honestly say that as I've traveled around the world, I've met the greatest and most wonderful people in my journey of doing work that we'll talk about, and I consider them my family. I've spent time with them. I've eaten with them. I've spent time at their houses. We've spent a lot of time together doing very emotionally life-changing work that's changed hundreds of thousands of lives of people, if not millions of people around the world. And sometimes you don't have that opportunity when you're in your day-to-day job. But sometimes when you get to go on a medical mission, or you get to go on a mission, certain things happen and you build connections with people you would never have thought of. You meet people that you would never have dreamt of. You learn of situations that you would never have thought you would have encountered. You are part of decision making and bringing ideas to a table of multidisciplinary people that changes lives. So this is my journey, and I just wanted to talk about it from my perspective as a believer and a person who is a follower of Christ. I really believe in this day-to-day activity that we do every day. Every day we wake up, maybe we have a shower, maybe we have something to eat, and then maybe we do go on with our day-to-day activity. But there's an interesting thing when we build this partnership or this linkage between the presence of God and our human activity. It's an incredible thing that when we're doing our day-to-day activity and we connect God's presence with us, and that our activity no longer just becomes normal. It becomes something that's inspired. It becomes something that's life-changing. It's becomes something that you would never have thought you would ever be involved in when you link what I believe is God's presence in our day-to-day activity. Because when his presence is not connected to our activity, the God that we serve, for us that serve God, it's not tangible what people see of God. And I love this last statement, and I read it many times today. It's not about doing more. It's about being with Christ and recognizing Christ's presence with us as we do what we've already been doing. Sometimes in our lives, we want to change the world. Sometimes in our lives, we want to become superheroes. But it's really not about doing more. It's about recognizing God's presence with us, and everything that we're doing has importance with that. So I love the idea of compassion. You know, I was as I was growing up, I spent time in my life of trying to figure out how to be compassionate and what this meant. You know, throughout the scripture and throughout our understanding of God, he is a person of compassion, right? And sometimes when we're in these circumstances, especially when we're dealing with people's health, people's vulnerability, that moment that they don't know what's going to happen with their life, you know, that we can be a person of empathy. We can be a person that's able to identify with them, and we can be a person that can care for them in these moments. So you might say, well, you know, I'm not a doctor, I'm not a nurse, but sometimes in these moments that you can be in a medical mission, it's not always about being the doctor that's doing the surgery. It's not always about the nurse that's maybe prescribing or taking care of the patient. Sometimes it's just coming to stand beside the patient. Sometimes it's holding the hand of a patient. Sometimes it's talking to somebody to let them know that that everything's going to be okay. So this idea of compassion, for me, it's listening. And I said to myself, well, what does this mean to be compassionate? And I think in the idea of this world that we're living in right now, to be compassionate, we really need to listen. Again, when I've been in hospitals, I've been in medical clinics, I've been with people who've been in car accidents, or people that are being on their deathbed, or people that are crying out for something because they're in a medical facility that's the only type of hope. It is that moment we can listen. It is that moment that we can care, and also listen to God. Because as we listen, then we can learn. So the other aspect that I think is very important when we look at medical missions or going into any type of a situation with any type of medical interactions is to learn what the situation is. And I think we were talking about that while I came on. The more prepared you are before, the better you will be during and after. So the more that we can learn about the country, the culture, the language, the roles of leaders and women and children, the more that we can learn about situations, the more that we can deal with people when we are in a situation of doing some type of a medical intervention. So listen, I think is very important. One of the things that I've read in the last 50 years of charitable humanitarian interventions is most people don't listen to the people they're helping. It's the number one thing I've seen when I've traveled all over the world. I've been in countries all over the world. I've been in mud huts. I've been in rural settings. And it comes back to the number one thing that all people always say is nobody's listening to me. Nobody listened to what I had to say. Nobody valued what I had to say. And no one cared about what I had to say. And if there's something I can instill in this conversation that we're having tonight or today for you, is to listen. Let's put aside our doctorates and our degrees and our accolades, because these people don't care about that. The people that are dying just want us to listen first. Second, as we said, learn, and then the how. Sometimes the how becomes a discovery when we walk through this process. And you might say, Tim, I don't understand what you mean. Well, we'll talk through some of this about how we can make a decision on sometimes of maybe going on a medical mission, maybe saying, do I have a place on a medical mission, or can I serve on a medical mission? And the how becomes an interesting part of the conversation. So I started an organization because I wanted to figure out a way to help people. My expertise, as was mentioned, I'm a water expert. I was doing work all over Canada, the United States, helping millions of people get clean drinking water. And as I traveled all over the world into poor, very poor rural communities, I found that the most of the issues that are connected to medical institutions like hospitals, clinics, any type of medical interventions are connected to some type of water issues. And I said, well, maybe because I'm an expert in water, why can't I do something to help people with water? So I started this organization. We're turning 15 years this year, 2008 we started. And our idea of starting the organization was to build partnerships. So everything that we do as an organization, again, I'm a guy growing up in Canada. My parents immigrated to this country, but I don't know people's culture. I don't know what goes on in everyday lives in these other countries. I don't understand certain cultural practices, but I do know who does know that. I have partners in every single country. In every single intervention that I do, I have a partner, a registered partner that works with me to help in this intervention that I do. I have not done an intervention where I don't have a partner. So my high recommendation, and I believe Dr. Bala was talking about this, is when you're going to go and look and consider at doing any type of a mission or an intervention or find a solution for a problem, the best way to win is to connect with the people that know the people that you're helping, not the people that think they know who the people that they're helping. So by doing that, then we empower our partner to work with us through a lot of those logistics, culture, economics, gender roles, leadership roles, all these different roles. Our partners help us through that. And that's how we actually became a very successful organization because of that model. I don't care about naming my degrees. I don't care about my university. That's not comes into the question. What comes into the question is how do I relate to the people that I'm working with, and then using that expertise. So there's an issue going on around the world with water, and most of everybody knows that on this call. And it blew me away when I was growing up in Canada that the number of people was devastating to me, and I couldn't understand that, you know, there's almost 1 billion people that today, right at this moment, don't have access to drinking water. That's probably within a 10 to 30-minute walk. They can't find clean drinking water. 2 billion people, so we hit about 8 billion on the planet right now, or close to it. 2 billion people can't even use a toilet, can't even use a proper way to deal with their human waste. And to me, this is something that needs to be addressed, and we need more people thinking about it. So what happens when you have a billion people not having access to drinking water, 2 billion people not having proper ways to deal with their human waste? This creates problems with the spread of disease, which all of you kind of know, right? This control of disease, this management of disease becomes something that becomes a problem because of these issues of improper water and improper sanitation. The villages I work with, a lot of the times they open defecate, right? They don't have water to even wash their hands, right? And they open defecate, and there's so much problems with some of these issues around diseases. So again, 11 million children die every year, right? So by things that are preventable. So where do these things intersect, right? So I wanted to kind of tie quickly that, my journey in getting into the medical aspect is I'm a guy who knows water, but I had no idea of the relationships that have so much impact with water and medical care facilities, right? Typical things. So WHO defines hygiene, there's conditions and practices that that help maintain health and prevent spread of disease, right? That idea that we just talked about. We need to prevent spread of disease. So how do we ensure that hygiene practices are happening with contaminated, dirty, filthy, parasitic and bacteria laden water? That's a problem, right? That's a problem. So we need to be able to help get clean water and proper water and to prevent the spread of infectious disease. So these are just typical things that water helps. Water helps in a medical facility with cleaning, sterility, with patients, with all of these different things begin to change the risk factor in people's lives just going into a facility. So here's some quick things that happen with water linked. Here's some microorganisms, and this is where they kind of live in unclean conditions in a hospital or medical facility, and this is what happens to patients, right? This is the outcome when we don't do things in a medical facility. I want to share a story, and this story is something that was very meaningful to me in my journey of working within hospitals and medical places around the world. And I tell this story to encourage you as a person that might be looking to go on a medical mission or to do something that's different than what you do every single day, right? Every single day you might have a job, or you might do something and you might say, well, I want to dream about making a change in a community or in a country or in people's lives. So I want to tell you this quick story, and I'm going to make sure I'm conscious of my time. But I was invited by the United Nations University here in Canada to attend a talk by this lady in this picture, this white lady. And her name is Dr. Jean Chamberlain, a very respected woman in maternal health around the world. And she came to speak at a university called McMaster University here in Canada. It's one of the top 5 universities in our country of Canada. And she came and spoke about the issues of going on in the country of Uganda in a hospital that she was working in that had no water and that people were dying because there was lack of water. And in this room that I was in at McMaster University in Canada, there was hundreds of people that had PhDs and masters and doctorates, and all of these students. The president of the school was there. All of these people were listening to Dr. Jean Chamberlain tell this story that there's a hospital in Uganda that people have to carry water to give to the doctor so that they can have medical attention. And the water that they bring is infected with bacteria and disease. And what happens a lot of times is people die because of the infection that happens. And this is the story that I want to encourage you with, is I stood in that room and I never met Dr. Jean Chamberlain. And she said to the whole room, she said, I don't know what to do. I'm a medical doctor. All I know what to do is what I know from a medical profession, but I don't know what to do with this whole situation with water and the issue of disease and all of that. But I'm asking the people in this room to help me. If you can help me, please do. And I was very much nervous and afraid to go talk to her. So all of these people came up to Dr. Jean Chamberlain and were hugging her and were loving on her, were congratulating her for a speech. And I waited to be one of the last people to talk to her. And I came up to her and I said, Dr. Jean Chamberlain, I know one thing. I know that I can help you. I don't know how I can help you, but I know I can help you. And I know about water, and I can figure out a way to help that hospital that's in Uganda, where people are dying every single day because of the infections that they get through dirty water. And this is what she said. She said, Tim, I'm a Christian and I've been praying. I've been praying that somebody like you would come. And she said, nobody in this whole room, all of these people in this university, not one person came up to me other than you. And that became the story of how I became involved in helping this medical facility that I'll walk through what happened. And I'm not a medical professional. I'm not a doctor. All I knew is that I'm going to find out who can help me, who can work with me, how we can accomplish this, and how we can save hundreds of thousands of lives, whatever we can do to help people. And this is what I did. And this is my encouragement. I was nervous. I had a lot of self-doubt. I had a lot of insecurity to go up to her. But the result of doing that and saying to her, I can help you change the course of this hospital and these people. So let's walk through what happened. This hospital services 600,000 people. It's located on a busiest highway in the country of Uganda, between Jinja and the capital of Kampala. It had no running water. I went to that hospital and I did an assessment. I went and spent time in that hospital. I connected with the staff of that hospital. And when I was doing the assessment and I met all of the nurses and the doctors, they were astonished that I would do that. And I said to them when I was there, I said, I'm going to come back. I'm going to come back in about 6 months, but I got to raise a bunch of money. And I'm going to come back and I'm going to help change this hospital. I don't know how I'm going to do it, but I'm going to do it. So 6 months goes by and I bring a volunteer team of not medical professionals. They weren't professionals. They didn't know about medical stuff, but they came to help. They came to help at this hospital. So when I came back 6 months later, I went into the room to address all of the doctors and the nurses and the practitioners and all of the people. And I said, I've come back. I've gone across the country of Canada and I've told the story of this hospital and I've raised money to help you. And I said, we're going to do this together. We're going to help change what's happening in this hospital together. And they all began to cry and began to weep. I've never been around people of that age began to weep. And they told me this story. They said, so many people have walked through this hospital and so many people have come and they made a lot of promises. They told us a lot of things, but not one of them have ever come back and followed through on what they've ever said. And they said, you are the first person to ever do that. And they began to weep. And it was an incredible moment. But I say that to say this, is that we have an important responsibility that when we do go into medical missions and we do go into vulnerable places, that when we do say things and we do things, that we are looking to do it for the long run. We aren't looking to go there just for that moment and never come back. So the hospital beds were torn and blood soaked, and you guys know all these things that happened in these places. I decided to work with the leadership. I decided to build relationship with the community. I decided to build relationship with the staff. Again, I'm not a doctor, I'm an engineer, but I do know that relationship is everything if we're going to make substantial change within any type of a medical facility. So I made relationships with all of these people, and I began to build trust with them, and I began to build a cultural shift within the hospital. So we brought medicine. We started doing painting. Non-medical people from Canada. They left their day jobs. They came to paint. We raised money and replaced all the mattresses. The women that were giving birth would rather sit on the concrete floors than to sit on those mattresses. And we changed all the mattresses. We did everything. The other thing that was happening in the maternity ward, which you probably know, is the women would come in and give birth, but they would be bitten by mosquitoes, and then they would get malaria while they were there for giving birth. And we said, no, we can't do that. So we changed the screens. We made that place a safe space, and we also created a water system that these people could use. Let me tell you what happened. Again, I'm not a medical person, but I tell you, the morale of everybody changed. If you want to have a high impact in a medical facility, you got to change the morale of the staff, of the patients, of the community. That ward now is continually full. As you know, since cesarean births increased because of the decrease in infection, wash practices, water sanitation, hygiene practices improved dramatically. They finally had clean water. The district of the country were coming now and celebrating. The ministry was coming and celebrating. The community was coming together and celebrating. In the first 3 months of the project, the sepsis rate was about 8.6. It dropped to about 2.8. And 10 years later, we're still at what we call a nominal zero. 30,000 proper births, that's another 30,000 children, 60,000 lives have been saved just through that, hundreds of thousands of people. This is hopefully you can hear it. This is the hospital administrator. So, it's been an interesting journey for me in my life and starting this work of H2O for all, and to be able to go into medical facilities. And this is just one example of a hospital that was on the brink of disaster and thousands and thousands of people dying. And I basically listened. I listened to what I believe God was telling me. I figured out what the issues were. I created a partnership with people in the country, which would Save the Mothers. And I figured out a how. I connected with doctors. I connected with medical people. I built a team on how to work towards solving the issue, right? So even though I'm not a medical person, the best teams around you are people that know more than you or have other skill sets than you. So that's what I encourage you when you look at some of these medical missions that you might go on. You know, look at your team, right? Build a multi-diverse team, multidisciplinary team, because not everything, all disciplines are needed. All approaches are needed, right? When we do that. So here's a young lady, and I'll close with this, and then we can have some interaction. But I encourage you. My life changed when I started to do missions. I started to go into places that people didn't really like to go. I started to meet people that their own parents and their own children would never visit them. And I encourage you that you would take some time, especially during this conference. Again, as Dr. Bala was saying, educate yourself, learn about things, learn about issues, learn how you can connect as maybe a non-medical person in a medical mission, and see your life changed. See your life totally changed. I'm hearing there's no sound, so which is unfortunate. So I'm not sure what we want to do now, Dr. Bella, but that's kind of how I was ending my presentation.
Thank you, Mr. Mutu, for the presentation. Thank you for the mission work out there. So at this time, we will entertain question and answer from the presentation made by Mr. Timothy Mutu, especially when you are volunteering as a non-medical professional for a medical mission. Yeah. Those online, you can raise your hand there in the icon, or you can send your question on the stream. Those in person, you can also, if you have a question for Mr. Mutu. Do we have a question?
We have David.
Yes,
Okay,
yes.
so Mr. David, yeah.
Yeah. I'm the one of the Christian leader in Hong Kong. Yeah, I appreciate what you're sharing today, brother. Yeah, may God bless you. I suggest that we have another. We had a product. Is make any water into the boat. Then we will come out with the pure water. If you're interested in this product, I will contact with you later. Okay.
Yeah, sure, absolutely.
Okay.
Again,
I'm David. I'm David.
Thank you. You can
Yeah.
talk to Dr. Bala, and he can connect us. One of the things that I believe in, and I had the honor of being at the United Nations.
Very useful. Very useful.
Yeah.
Yeah.
United Nations Water Conference in New York a couple months ago, and I say this: the idea of collaboration is something that we need to always think about. How can we collaborate with each other on the same goal? So
yes, very good.
I appreciate
Yeah.
David. yeah, you can reach out to me through Dr. Bala.
Right. Thank God that your testimony touched my heart. Okay. Thank you
Thank
very
you.
much. Okay.
I appreciate that.
Yeah.
Jonathan Hart, Jonathan.
Okay, team, there is a question. Somebody's as interested about you sharing, but the question is, how can we connect to God? How can we listen and connect to God and be able to have an answer instantly? It's a question I'm relating. Yeah.
Well, again, I think the word instantly might be something that I would not necessarily say that's. I think when we're going through the journey of any type of journey, it's like a relationship with a best friend, your spouse or your wife or your husband, and you're basically saying, I want the answer right now. And your wife says, well, no, I need to think about it and I need to spend some time dwelling on it. So I think when we talk about our relationship with God, I think we need to be able to be patient like any relationship and take that time. I'm not saying that we can't make decisive decisions with the intelligence that God has given us. As an engineer, a lot of times I have to use my intelligence and training to make decisive decisions, probably the same in the medical practice. But I think anything to do with listening to God is just something that we should take time at. And I don't believe it's something that can be done instantly. I'm not saying it can't, but I would say spend some time. Right. That's my answer.
Okay, thank you. We see another hand up. Dr. Hart, can unmute the microphone.
I think I'm on mute.
Okay.
Greetings, everyone. Are you people getting me?
Yeah.
Yes, yeah.
I want to tell Timothy, thank you for this inspiring message, experience shared. What I want to say is that it is a challenge in most part of Africa for people to volunteer, because I think that people most people have different understanding of the word volunteerism. And I believe that the only way we can be committed to the system of volunteerism is that when we see those who we want to help, we see them, we put ourselves in that shoe and understand exactly what they are going through, and come to realize that there is a need for someone to step in and help. We will find it difficult, to have the type of success that we want to help in our desire to volunteer. I'm impressed by their success. I have read a lot of stories online from the Western world and other developed countries where people come to understand the idea of volunteering. And I think this is why most of the times Africa has become a bedroom of dependency on medical missions and other missions outside of Africa, because we the Africans think that another man's problem is not our problem. But I want to thank you for sharing this inspiring experience. And I think that we can make the world a better place as Christians if only we can empathize on the situation of those people. There are a lot of people that need help. A lot of people need help that they cannot get. But just the little effort by each and every one of us, little effort, the least we can do to help, can change our world around and can make it a better place that everyone can have reason to smile and to celebrate God. So I want to thank you for this sharing of knowledge and experience.
Wonderful. And that's kind of what I was starting at the beginning of this birthing empathy and compassion and asking God, some of those things we have to work through, and becoming vulnerable around people, right? and being able to listen to people. And I gave that example. Sometimes our culture is we don't want to listen to anybody. We don't have time to talk to anybody. We don't have time to connect. And as you said, Jonathan, and you said it really well, you know, we need to do that. We need to be an example of that. And we need to teach that. And that to me is all part of the mission, or you know, the daily life is the mission, right? The daily life of how we act and do that, as I call the journey. But thank you. Again, I am nowhere near where I need to go, but it's a journey that we're all on. And I was praying to God to create in me empathy for people I don't even know, people I've never met. And I think you said it really well. We can teach that. And in Africa, I spent a lot of time on the continent of Africa. It's something that we need to be able to teach, something we need to model and be an example of. And yeah, I agree.
Okay, thank you very much, Mr. Mutu. And may God continue to bless you as you continue to mission for Him. And thank you for that great job you're doing out there in the world. Thank
Thank
you.
you.
Okay. Okay. So at this time we don't have a snack break announcement. So welcome, Dr. Bala.
Sorry, we didn't do some housekeeping.
Yes.
So right behind you there is the bathroom. Yeah, the bathroom is right there. Sorry, we have done that from the very beginning. We just do that. So the bathroom is there when you enter. You get the DNF committee with that. Yeah, so sorry for that. And also we want to say that out there, those of who signed for in-person, once your name is on the list there, you just put your signature. So package is there, new tile already have your name already on it. But we still have blank for thinking just in case somebody show up who didn't sign up so that they can write your name. So we want to encourage you, please, yes, let's sign up so we can know those are in-person as well. And we also online, those of you that are online, we follow, we only giving certificate of participation to those who actually participate. So we want to do that. So we hope to have launch. Sorry, I know we're used to having launch in China exactly 12th, but we have launched later after 12 because the launch will be ready, but the next person speaking from Canada, we don't want to, it's like AM already, we don't want to keep her too late, so she will come on by 12, so that right after 12, then we will be able to have lunch. But we have the snack break. After the snack break, not just snack, just tea, stretch ourselves a little bit. And then we have the healthy energy exercise. So what we have in the break, get some tea out there, stretch your legs, take picture, then we readjust the place for the healthy energy team. It's gonna be, I think we've been very quiet, so it's gonna be something very active. Yeah. So our team is here already to do that. So let's stretch our legs a little bit. Yeah, get out there, go to the environment, take picture, get a cup of tea if you can, and then we come right back here in a few minutes to do that. And again, we want to say right near the bag there is a bag. So if you are in Guangzhou, if you live in Guangzhou here, or you want to be here tomorrow, a couple of days, one of our sponsors major sponsor is the GICF, the Guangzhou International Christian Fellowship. So the bag right near the registration there. So there is a flyer information about GICF and a notebook, and a bag to keep your things. So if you're in Guangzhou, we want to invite you to GICF tomorrow to service, so you can take a bag there, and then you can know more about GICF.
Okay, thank you very much. And also, we just want to recognize those who enter. Sister Katia from Uganda, welcome. Sister Taya from Liberia, you're welcome. Into our Healthy Energy team, you're all welcome. Thank you. Okay, so you can have a refresher in a few moments, and we can be back in the next 11:15.
They start with their own music for first round.
Okay.
And then afterwards, you see my sign. And then the second round is the Christian music.
Okay.
So it's showing the difference between the worldly Tai Chi and the new Tai Chi with worship and faith.
Okay.
This is the first attempt. That's why I've invited my friend, who is a leader of the church in Hong Kong, who just asked a question. David. Okay, and also, a strong Kung Fu person in Hong Kong. So, okay.
加一下。
Hello，大家好，很高兴我们一起见面。今天我们主要是跟大家一起分享一下中国人的现代理念太极运动系列。我们可以一起互动一下，好不好？这个运动可以通过一个肩颈腰是一个非常好的修复一个状态。通过长期锻炼可以调理气血，使我们身体产生很大的变化，疏通经络，改善身体的经络，让它气血上通，让我们身体无力。好不好？我们可以先感受一下。所以我们先让我们的叶波老师可以做一个健康人面运动的强臂功，就对颈椎胸椎、腰椎骨骼的一些修复，请他示范一遍。这个动作是一个先示范，两手相合，这是一个对拉，舒展我们的胸椎，收腹敛臀屈蹬，这是我们腿部起了一个锻炼，增加的能量。收腹敛臀，低头，含胸拔背拱腰，这个动作对我们的腰椎板起了很好的修复。但每个动作也要柔和缓慢，要有停顿感觉。这个动作停顿一下，这个动作是我们秋线的叫灵龟戏水，这个都是增加我们全身的能量的起立。别小看这个动作简单，真的在我们做的话呢就不容易。如果我们从这3个动作我们做个评估了一下，你能够连续完成3个，说明你的体质合格。如果你连续完成不了3个，就说我们的体质要义务的要去加强锻炼了。来，我们一起跟他学习一下，好不好？谁敢？可以上来，可以一起上来，运动一下，感受一下，好。对。
So now it's gonna, you can come on stage to kind of like exercise along with them. You're teaching couple of moves. So you're gonna be teaching couple of moves. So we get an English translation there, and then after the couple of moves, then we do together.
上来几个，上来可以，上来上面也可以多练，好不好？对，那个叶波老师在前面了，在前面，对，就这样子放下，我到看，对，来感受一下，上面来上，来，这个上来几个，对，那位对，可以站2班，可以在下面那一座，好吧？对，但是也可以，这是上下对吧？来，跟他一起做，站2排，非常棒。错开，对，对，对 ，OK，好，你往前可以摆给，对，好，你过这个摆给相互，对，来，会用跟他一起学，好不好？会用，对，两手上举跟着做。来，可以就里面叶波老师，就2个手抬高一点，这个手往上抬高一点，2个手相合，小慧老师在哪里？纠正一下，对，相合，让我们颈椎怎么样？顺站起来，你试一下，没关系，抬越高，腰会酸是吧？2个手要相合于肩同宽，对，控制5秒钟，1、2、3、4，对，非常棒，不对，好，2手上举，手心相对，到手心向前，对拉，伸展，然后就这样拉伸一下， 往上拉伸，向上拉伸，对，拉伸，对，拉伸一下。好，屈膝屈肘，跟着模板蹲，含胸拔背，啊，收腹敛臀，对，收敛，蹲下去，两个肘保持与膝盖同宽，对，好，落手落下去啊，低头，低头，含胸拔背，翘臀，拱起来，低头，对，低头，低头，5秒钟，5、4、3，太棒了啊 ，good，好，1，好，全蹲，两手勾辫展，抬头，两个手举高一点，小心，哎，两个手举高一点，举高一点，好，塌腰抬头起身，起来，起来，起来，加油，加油，啊，太棒了，加油，现在是1个了啊，我们检验我们的身体是不是活跃的啊？对，停顿3秒钟，1、2、3，好，放松，对，肩松、腰松、颈部松，继续1，上举，重复的 ，again，对，好，两手相合，与肩同宽，给他们纠正一下，对，多纠正一下，塌腰，一定要塌腰，这个对我们颈椎、胸椎、腰椎起了一个什么反形啊，这种对拉起了牵引作用，好，两手上举。伸展像伸懒腰一样，啊，中正，手指尖朝上，尽量朝上，哎，加油，朝上，好，3，用力伸懒腰，2，好，1，屈臂，啊，屈臂，屈膝，啊，全蹲，含胸，啊，拔背溜臀，看能不能蹲得下啊，非常棒，啊，肘膝相合，好，落手。重心前移，低头，含胸拔背，拱腰，成勾手，勾尽量向脚两侧往下走。好，低头状态，3、2、1，全蹬，抬头，两手勾辫展上举，塌腰，控制5秒，5、4、3，抬头，抬头，要抬头，抬头，啊 ，hand up， 对，啊，起身。起来，塌腰，仰头，两手向后，两个肩挤压，特别是两个肩挤压，刺激我们的大腿穴位，啊，对我们预防这个颈椎还有感冒非常有好处的。放松 ，again， 再来一次，松肩，松腰，好，上举，加油。两手相合，对，抬头，塌腰，仰身，让我们的颈部啊、腰部有酸胀感。控制3秒钟，好，两手上举，两手上举，哎，对拉，非常棒，哎，伸展伸懒腰，伸上去，加油，对，非常棒，好。屈肘，含胸拔背，屈蹲，慢慢蹲 ，slowly，慢慢的，控制一下，落手，低头，翘臀，对，翘臀，控制5秒，低头，对，5、4、3、2、1，好，抬头，仰头，对 ，up hand， 举手不动，对，举高一点，5，抬头 ，look up， 哎 ，up look， 对，起身，哎，起，仰头，塌腰，仰着塌腰，5、4、3、2、1，好，放松。哇，太棒了！掌声一下，给他们鼓励一下，完成3个，哎，不重，有没有出汗？有没有？
Are you sweating?
感觉怎么样？Yes, no. 感觉怎么样
How you feeling?
OK。有出汗了吗？哎，有出汗没有？
Sweat?
谁有出汗没有？ 这样的运动多半都是排骨。其实我们这个就要排骨。好，下面我们做主要的这个穴位的拍打，来给大家感受一下。一个是肘窝来预备，手心要空，来示范一遍，推一下，对，用这个方式拍打，来预备，打2个机会预备起，2、3、4、5、6、7、8、2、3、4、5、6、7，换手，换这边，对，right， 预备 ，go， 1、2、3、4，有水力 ，push。5、6、7 ，OK， 好，up 举，打腋窝，看到腋窝，预备，走，1、2、3、4、5、6、7、8， 2、3、4、5、6、7，看手，不要放手，预备起，1、2、3、4、5、6、7、8， 2、3、4、5、6、7 ，OK， 好，虎口沟这个位置用的力，预备起，1、2、3、4、5、6、7、8， 2、3、4、5、6、7，好，好的，这个大腿中间预备起，1、2、3、4、5、6、7、8， 2、3、4、5、6、7，好，小腿足三里来，足三里是一个穴位来的对我们的肠胃预备在这个位置这个位置来 look at 这里，预备起，1、2、3、4、5、6、7、8， 2、3、4、5、6、7，好，来腰臀部腰的位置，预备起，1、2、3、4，对，去打四呗。这个动作对于我们有的腰劳累了，我的一天工作累，会推腰、搓腰，很舒服的。来搓一搓，搓，来不时搓，有没有热感？搓热它，有感觉吗？搓热，再推，对，好，放松，敲打颈椎，两手合拢，对，敲打颈椎，这对我们感冒有好处对，预备，敲打look 这个位置大椎我们的大椎穴位，大椎，预备起，1、2、3、4、5、6、7、8， 2、3、4、5、6、7、8， 3、3、4、5、6、7、8， 4、3、4、5、6、7，好，这个穴位最重要的穴位叫膝腘窝，是我们人体排毒区域最大的一个部位。预备，先看它一眼把膝窝中间合在一个的，预备起，1、2、3、4、5、6、7、8， 2、3、4、5、6、7、8， 4、3、4、5、6、7，好 ，OK， 来这个肩颈穴位，这个单边，右手在前，等一下跟披萨讲右在前来先打左手对左肩你的左手跟我们右肩有没有预备起，1、对，2、3、对，4，用点力，5、6、7，对，8，好，翻手，好，对，这个不动，这个手举高一点，劈，用掌人劈到我们大腿位线，看对的，预备起，1，对，2、3、4，对，5、6、7，对，8、9 ，OK， 同时来举手，预备 ，look， 预备看看，对，别打错地方了预备起，1，对，一起下3下，2，对，3，对，4，对，5，对，6，对，7，对，8，好，换脚，左脚在前，对 好，下面单独练一下，右手可以肩，可以肩，预备起，一，对，二，对，三，四，五，六，七，换手啊，举左手举起来，击到我们的大腿内下，预备起，一，对，二，三，四，对，五，六，七，对，八，好，同时预备起，一，对，二，三，四，对，五，对，六，七，八，好，太棒了，停，送，啊，怎么样？随时发热没有？来，掌声鼓励一下，掌声，好，非常感谢大家，好，请，好，下面我们最后一个大号舞，可以一起唱歌，一起互动，就是我们一起。
都可以，就用那个音乐了，这个音。
在哪？可是他拍了，拍了，再拍一次，然后全拍。他们拍的真拍。
All right. After the stressing, you have lunch.
好，那刚才我们进行了一个提炼，下面我把这几个动作，它有套路形式的，又能演练，又能自我锻炼，又能这个观赏性也有现成效果，非常好。下面我就把这几个动作看我把它组合的练习一下，好吧？Yeah. 刘伟。
Good person worship.
Right. 这是一个完整的表演下面我们最后一个到我们中国的一个太极拳8和5步一起一样。好。
Was it same? So we're gonna do Tai Chi with praise. Praise and worship and exercise. So that means you can, like, I think Dr. Janelle would love this. You always be praising and you can exercise, right? So we're gonna do it together? Yeah, so you're welcome, Stan. You already exercised enough, you active now. So we're just gonna do a few days and before we go to our next section. So we can even sing the song together as it go on. Yeah. Stand on our feet. Goodness of God. We should give them another hand and applause.
Which song is it sing? The song sing.
Like from the beginning.
Just sing. Or sing by the song. Play the song. Play the song with singing.
Oh, there's this.
Yeah. They sing, not us.
This one is just the. Okay. What's the next time for the next section? What the next time for the next section? See? All right, already 10 minutes to the next section, so we have to, yeah, get this. She already on. She already on.
Thank you very much for that healthy energy exercise, Mr. Lee and team. So thank you. You know, in the wake of increase in cities, physical activity is a cardinal aspect to curb the increase of those conditions. And know that we all enjoy ourselves, except for us behind the camera and the microphone. All right, so we already into time, so we have that Reverend Tetley will be speaking to us, our third speaker, volunteering as a support team member. Volunteer as a support team member for a medical mission. So briefly, we'll introduce Reverend Tetley. So Reverend Sonia Tetley has over 20 years of experience in the church and non-for-profit world. She and her husband, Jordan Tetley, led Church 365, a global online church. In addition to serving the church, she also works as a consultant for several charities, helping in project management, digital marketing, and donor portfolio management. One of Sonia's passion is seeing the church's work expand outside the church walls. She has been part of pioneering several innovative missions projects by pursuing kingdom partnerships and exploring creative ways of evangelism in her work and ministry. She is excited to share her experiences serving as part of a medical team and also leading international mission teams. So at this time, we'll now join Reverend Sonia Tetley, who will be speaking to us on volunteering as a support team member for a medical mission. So Reverend Tetley, you're welcome.
Thank you so much. I'm so glad to be with all of you here today. And you know, I think the enemy wants to keep back from what God wants to do in this group of people here. My husband and I were at a wedding this evening. He was officiating, and that's why I took the later spot today, because I said to Dr. Bella, I want enough time to make sure that I'm back in time. And as we were on our way back, there was a major accident on the highway. They closed the highway. There was all kinds of ambulances and fire trucks that were rescuing. And thankfully, I am here I'm safe, but I'm so excited to be with you. I believe that more than my experience, I hope that you're going to catch the heart for mission from me today as I share some of my experience as both a pastor and somebody that works with the nonprofit sector. And so, as you were hearing before, my husband and I, we pastor an online church called Church 365, but we've been in ministry for 20 years now. So we got married in 2003. We've just celebrated our 20th anniversary this month. And we were sent to Asia as to serve. And so we first we got married, had our honeymoon, took a plane to Asia, and we were serving as youth pastors in Asia. And later, within 2 years, we became senior pastors of an international church. And so I want to open up with a story from 19 years ago. So I had been fresh on the field coming from Canada to Asia, and I had this opportunity to go on my first medical mission. A good friend of ours that ran medical mission trips all across Asia had connected with us, and he asked my husband and I, would you come to this remote region in Asia and be a part of the team? And so we were kind of new to Asia. We were just learning the language in the country that we were at. Our language level was really low. But he asked us, he says, why don't you come as photographers and videographers and just come and serve? And so I want to share the perspective first of what it's like to be part of a really effective medical mission, just in that serving role. So this was 19 years ago, just fresh on the field. And so I went to this remote region with my husband, and we were just there as a support team. And so this team was an extensive team from the US. They had dentists there, they had some surgeons, they had eye doctors that had brought suitcases full of eyeglasses ready to serve these people in this rural region. And so in this region, we traveled every day to kind of remote places. We went kind of up to the mountainside. We went to smaller villages or cities, and we had a schedule over the period of about 10 days where we were in different villages or areas for two days at a time, sometimes even one day. And so when we went into these areas, the poverty was just, the need of the people was so great. Some of these people, as we got to know them, they had needed to see a doctor for years, but they didn't have the money, they didn't have the ability, and the fear of what it would cost. If you live in the West and you have access to public health care, you don't have that fear. If you have insurance, or if you're, I feel blessed that I'm in a country, Canada, where we have universal health care. And so if my children are sick, I don't have to fear if I take them to the doctor, if I'm going to lose my home or my, everything that our family is safe. But that's the position of many people in the world, that when they have a medical problem, sometimes they don't have the choice to make. And so when this team came, as we were expected, when we went to many of these regions, the need was greater than actually what the team could meet. And so I remember one of the first days we pulled into this small town, and it was early in the morning. So our team was setting up, we had an early breakfast. I think it was around 7:30 in the morning, and we were setting up the stations in the hospital that we were serving in. And the lineup had already begun, and it was down the street, down the alleys. And I remember as a team, we realized, okay, we're not going to be able to see every single person that needs care today, but we're here for a purpose. And so what seemed like, as a newcomer for me, this seemed like an unsurmountable problem. I thought in my mind, oh, this is a crisis. Like, we're not going to be able to see all these people. But this team didn't just come with a team of medical doctors, but there was Christian workers, there was teachers, there were students, there were people that were ready to do the ministry side of the spiritual ministry, I'll say, of this mission. And so as the doctors, were caring for the patients one by one, and it was long days. If you've ever been involved in a medical mission before, it's often very long and grueling days, difficult conditions. Sometimes there's not food available or food that you're used to. And so the doctors were very tired. And this line, as the day went on, just kept getting longer and longer. But there was a couple that was leading this team, and they were not the doctors, they were the facilitators. So these were the people that organized the doctors, that set all the logistics on the ground for this team that was coming. And they weren't phased at the lines at all. And actually, they saw the lines as an opportunity to begin to share. And so I watched this couple, and at the time, my language level wasn't very good. So I couldn't have these in-depth conversations. But I just saw this couple, and they would sit in the waiting rooms, and they would sit and they would hold the hands of the patients that were waiting, and they would just simply ask them, why are you here today, and can you share your story with me? And as you know, some of these patients were waiting hours and hours, and this team of people that had come were able to sit and do the spiritual care as they waited for the physical care. And I was just amazed that as people began to open up their hearts and they began to share, you know, some of the most heart-wrenching stories. And you know, if you go to impoverished areas, you know, some stories are so painful to hear of the suffering that people are facing without the access to medical care. And this couple was able, you know, to turn to them and just love on them. And often, you know, I didn't speak the language very well, but I could see the people's hearts were so moved that these people from another culture, another country, had come all the way to the other side of the world to care for them and their needs. And so they began to ask questions, you know, why would this team of North American doctors come to this side of the world and give their time, lose their salary for these 2 weeks, you know, give up their time to serve us? And that was the opportunity where the team that was there doing the spiritual care was be able to begin to share the real reason of why they had come, and the love and the motivation, what was driving them to come and care for those people. And so I would, you know, as a very young person, I think I was very young on the field, you know, I watched in amazement as this team just worked together. And, you know, the doctors were working with such excellence. They were providing amazing care. But, you know, they were so busy. They were going from patient to patient to patient to patient to patient. But that supporting team on the sidelines, not only were they in the waiting room, but as they talked and worked through the waiting room, and so many people began to give their life to Christ as the ministry team just loved on the people there. And they not only did it in the waiting room, but they went into the streets, they went down the alleys, and they just showed the love and care. And even for some of those that they knew weren't going to be able to see the doctors that day, I remember the one lady turning to them saying, you know, I'm sorry, the doctors aren't going to be able to see you today, but what I can do, I can pray for you. Can I pray for you today? And so I want to encourage you, you know, as you think as a team, as you think as doctors, as you think as medical professionals, and maybe there's some pastors that are on the call listening here, when you're thinking about bringing a ministry team, a medical mission team, to really realize that it's important that you have that support team, that that mission, yes, we want to bring better quality of care and life to people. We want to bring healing to people through our skills and our talents. But we want to bring them to the truth of why we are motivated to love and care for them. And so there is such an opportunity. So I would say on that first medical trip, that was my first kind of medical mission, so to speak. It really opened my eyes how you, when you bring when you come to people and meet these practical needs, whether it's, you know, giving someone a pair of eyeglasses for the first time, or putting someone at ease and saying, no, you're not dying of cancer, you just you have stomach problems and you need to eat better, or whatever it would be, to bring not only just the physical help and care and hope to people, but we have a message of joy and hope that God has given us to bring to other people. And so I hope as you look towards this, that God will really open your eyes to see that the opportunity that he can use through your gifts and talents as medical leaders and professionals. And when you partner together with, whether it be a church or whether it be you know, other people that maybe they're students that aren't medical doctors yet or nurses, but they have a heart to serve, or you partner with people that have those gifts evangelism or gifts of just love and care for people, on how you can use your gifts and talents to really impact people for the kingdom. You know, one of the things over my many years of being in ministry, so you know, my husband and I came from Canada, we went to Asia, and during that time, God used our international church to take multiple trips. Sometimes we went to tsunami ravaged regions, we went to earthquake ravaged regions with medical teams. There was other times where God sent us to different places in Africa from Asia to meet a specific need. And, you know, our church was a small church. We weren't a big church. We had about 150 people. And we always felt a strong call that it didn't matter our size, but that God had called us to be globally minded. And so sometimes people that would attend our church would get really confused because they would say, well, we already are globally minded. We're an international church in Asia, and we already have the mission field here. And I want to challenge your thinking today that when the gospel went out, when the Holy Spirit came and empowered the disciples in Acts chapter 1, this is what it said. It said, but you will receive power when the Holy Spirit comes upon you, and you will be my witnesses in Jerusalem and in all Judea and Samaria and the ends of the earth. A mature and a growing church will have a global mission mindset. You see, if the church only stayed in Jerusalem, the church would have died. God used persecution. He used all kinds of means to push the gospel out. And I really believe sometimes, especially in developing countries, some countries have this mentality, you know, we need the missionaries to come to us, or we need the care because we are struggling, we have our own poverty. You know, once we deal with our own problems, once we are strong enough, then we can go out. But that's actually not the biblical model. The biblical model is, yes, you first reach your Jerusalem, then you go a little farther, you go and reach your Judea, and you reach your Samaria, but then you also must go to the ends of the earth. And from my experience, some of the most powerful ministry that I've ever been a part of, it's cross-cultural ministry. Just like when I shared that story on that first medical mission trip I went on 19 years ago, the people were so moved. This was a rural area where non-Asians never went, that people would take their time, their money, their resources, their gifts, and come to the other side of the world to serve them. And I want to tell you that there is a movement that's happening across the world where the church is going out from places that actually are places that are developing, and some of them are in great poverty. When you look at the pattern of the gospel, it started in Jerusalem. It went out to Judea, it went out to Samaria, it went to the ends of the earth. But if you look historically, it moved into Europe. And then over the centuries, it moved as persecution happened in the church. Christians were fleeing to the Americas because of religious persecution. You know, the gospel went out to the Americas, to North America and South America. And over the years, you know, North America, now Canada, I would say we don't really have very much of a Christian background anymore, but, you know, a couple generations ago, all of North America would have called themselves a Christian nation, and they were sending out missionaries to Africa, to Asia. And so the gospel, you see throughout history, it makes this circle around the globe. And if you look at present day history, where is the gospel going out from at this point? If you take a look at the movement of mission that's happening right now, it is happening out of Asia and Africa. That God is calling Christian leaders. You don't have to be a pastor. You can be a medical doctor. You could just be a lay worker, but God is sending out workers back through to bring the gospel through. They're going through the Middle East. There are so many Asian workers, Asian Christian workers, that are giving their lives in the Middle East right now. They've gone, and they know that when they go into some of these countries, this may cost them their lives, and they're bringing the gospel to those places. You know, one of the most powerful experiences that I had in our ministry, you know, our church was based in Asia, And, we had a number of actually Liberians that were coming to our church, and many of them were actually in Asia as refugees. As a result of it, our church was just loving on them and caring on them. And the word in the Liberian community began to get out that this church in Asia was really caring for the Liberian community. And so we began to see the embassy staff starting to come to our little church of 150 people. And, God began to put a burden on us, this international church in China. He began to speak to us as pastors that we had to do something about the pressing needs in Liberia, as they were recovering from the civil wars, as, investment had not come yet into Liberia from many of the Asian countries that have now invested into Liberia. We just felt like the Lord saying we had to do something. We didn't know what to do, but we felt like God said to do something. And so we talked to the church members that were a part of the embassy, and we said, what can we do? What are some of the needs? And, the embassy staff said, there's huge educational needs. Our schools there are struggling. They don't have resources. They don't have materials for the children. Maybe, we can send something from China. So we did a fundraiser. We filled a container full of backpacks, and we said to the embassy, we're going to pass this on to you, and you can administrate it and give it to the people of Liberia. And the embassy staff said to us, no, we want the church to administrate it. So here we weren't planning to send a ministry team, but we sent our first missions team to Liberia, Africa, and that would have been around 2007. And when we went there, that was the start. And I remember the day the container landed, one of the embassy staff called me up and she said to me, we've been really trying to get investment from Asia into Liberia. And she said, I'm so excited that today the container's landing and the first investment from Asia is coming from the church. And, here we were, just this little international church of 30 different nations that were there together. And actually within several months, the infrastructure and the investment from Asia began to come through the embassy. And we saw, Asia putting in roads and electricity and all these things. But I believe that our tiny little church in Asia would pave the way for some of the economic growth that came into Liberia. Not that we did anything special, but we said, we're going to go when God says to go. And when you go, when you answer the call, when God says to you to go to somewhere, it might be the town next to you, it might be to a village, 5 hours from you, or it might be to a totally different country. When you answer the call of God, something changes in the spiritual atmosphere. And so I believe as teams, as you have this vision to go out as medical doctors, medical professionals, to go out and serve, you're not only going to change the lives of the individuals you care for, but something is going to change in the spiritual atmosphere when you go into those places. So we ended up continuing doing ministry trips into Liberia. I think we sent probably 5 containers. We built a school. We helped support a number of orphanages. And over time, we began to share this vision with the church, the local church in Asia, so not the international church. And we began to share with local pastors. And we said, this is the need. You need to come to Africa and you need to see that it's the Asian church's turn to come and do mission. And so I remember the first time we brought a Mandarin speaking pastor, and he came to Liberia, didn't speak barely a word of English. And, he saw the needs there, and he had a lot of connections with farmers. And he said, look at the land here. It is so fertile. We need to teach orphanages. We need to teach these people how they can become self-sufficient. It's so simple. We can teach them how to care for the land, to grow crops. And so that was something that we did. We said, okay, we're going to teach the orphanage that we're working with how to farm. And I remember he went back and he was so passionate. He went back to the churches in Asia and he said, you think you have poverty. You've not seen the type of poverty that I saw when I went to Africa. And he went to these poor rural churches. These were not churches that were wealthy in Asia. These were poor farmers. And he said, you need to sow into the work of God. And so he went around from village to village, sharing what was happening in Liberia. And he collected from all these rural farmers, they began to send seeds. They began to send corn seeds and watermelon seeds and all of these seeds that came from these poor rural churches. And, you know, sometimes when there are countries that have been on this receiving end, and there's many very wealthy countries in Asia, but there's many countries in Asia where they have had extreme poverty, and yet God was raising them up to respond to the call. And so I want to challenge, you know, I know that there's some people that are in this training today, and maybe the country that you're from, you say, you know, I don't know if I can go on mission somewhere else or even mission in my own country. The needs around me are so great. I want to tell you that if you answer the call, if God is calling you to go, whether it's next door, 5 hours drive away, maybe it's 15 hours on a plane, that God is going to provide for your needs for that trip. And you going will also inspire other people to go. You know, I think often about the church in Macedonia. And this is what it said in 2 Corinthians chapter 8, verse 1-2. Paul says this, and now, brothers and sisters, we want to know about the grace that God has given the Macedonian churches in the midst of severe trial. Their overflowing joy and extreme poverty welled up in rich generosity. For I testify that they gave as much as they were able, even beyond their ability, entirely on their own. You see, this is the Great Commission. This is how we see the gospel going out. It is not just the wealthy coming and serving the poor. It's actually everybody answering the call. You know, when I shared that story of those rural farmers, they gave a huge sacrifice, giving suitcases and suitcases full of seed that could have went into the ground to bring them crops. But they gave it because they knew their brothers and sisters in another country have need. When we look at this church in Macedonia, who is in severe trials, and yet they gave till it hurt. And sometimes when God will ask us to give until it hurts. I know there was times in our ministry when God was calling us to continue supporting some of the projects that we were supporting in Liberia. I remember there was church members and they were mad at us. They said, here we are a church in Asia. We should be doing mission in Asia. Why are you going to Africa? And we said, we are doing mission in Asia. We are meeting the needs of the poor in Asia, but we can't neglect the call of God has called us to go. And it's so important when we talk about medical mission, when we talk about outreach, when we talk about evangelism, but we capture God's heart for people. God is calling you out, not just to showcase your skills or not just to meet a physical need, but he actually wants you to use your gift to meet the spiritual needs of the people that he is going to bring you to encounter. So I don't know if the PowerPoint can come on the screen, but I do have a few notes that we can go through there. I think it's right there saying volunteering as a support staff member. It's a PowerPoint there. And if we can put those notes on the screen, that would be wonderful. So I want to talk a little bit really from a pastoral side. So my husband and I, leading an international church and now leading an online church, you know, we had the opportunity to take multiple teams on missions trips. And over our 2 decades of ministry, there's some things we did really well. And I want to tell you, we made some terrible mistakes. And I hope as I share some of my experience, that I'm going to save you from some of the terrible mistakes, because sometimes with a good heart, we can have good intentions, but without the wisdom, sometimes we can cause even pain for ourselves and we can cause pain for others. And so the first thing I want to share about the importance of how to organize an effective medical mission is to come with an attitude to serve. And so one of the things I've learned over my years in ministry is missions teams can cause great damage when they forget that their mission is to serve. When we come, especially when we're talking about the cross-cultural context. So if you're coming from your country to another country, and sometimes even coming to another region, it is so important that you remember that we've come to serve the people there. We're not there to build our own ministry. We're not here. When you send out a team from your international fellowship, you are not there to promote your fellowship. You're there to lift up the people you are coming to serve. And so this means when we come into a culture that we're going to honor the culture, we're going to take time to learn about other people's culture. We're not going to do things that offend them. And even if things that we like to do, we're going to hold back if it means that it's going to offend our brother or sister. You know, I remember one time, you know, in North America, I don't like them, but tattoos are very common here, and for a lot of people, it's culturally acceptable to have a tattoo. Now, bringing a ministry team and a team that's coming to preach and to share the gospel, having a tattoo in some countries is not acceptable. And I remember one time we had a young person on our team, and we had to say with them, you know, we're coming here to serve. If you're going to speak on the stage, you need to wear a long sleeve shirt and cover up your tattoos. Now, that young person at first was like, well, they should learn that, you know, they should learn that they should accept me as who I am, right? And we returned to that person and said, you know what? Yes, they can learn acceptance, but you are here to serve them. They are not here to serve us. And so when we come on a mission team, whether it's a medical one, whether it's a church one, whether it's just a ministry trip, we want to come and honor the culture or country people group we are serving. Serving also means being willing to live at the level of the people you come to serve. And so I have been utterly shocked with missions teams that I've brought their expectation of wanting to, you know, have a North American experience in a developing area. And so if you're bringing teams from North America, this is really important that you train about this. Now, of course, we need to put our, you know, if we have doctors or people that are coming, we need to put them in safe and secure housing. Of course, we don't want to put them in dangerous areas, but we want people to come with an attitude that they're not coming to go on a vacation. They're not here, you know, just to come and have what we, you know, I sometimes call it mission tourism. Mission tourism does nothing for the country that they're serving, and it does nothing for the spiritual growth of people that are coming on the team. So one of the things that you'll learn, especially if you're leading a team, is coming on a trip is a tremendous opportunity for the individual's personal growth. You'll see as people come on a trip, that things will happen in their life. God will put his finger on things that need to change, and their eyes will be open to see the world in a different way. One of the big things that we learned through our many missions trips was always teaching our team to understand that serving means being prepared to be generous. And so when you're going to be generous, that means that you're going to come on a trip prepared to be generous. And so, you know, as you take trips, you'll discover that sometimes when you're planning a medical mission or you're planning a trip, things do not go as planned. Maybe you plan to rent a car and that car breaks down and now you got to rent a second car. Maybe you planned to have housing and it falls apart and you have to spend more money on housing than you were expecting. Maybe the need is great. There's a need that you never anticipated, but God will ask you to meet on the trip. I would challenge you, if you are going to go on a medical missions trip, even if someone is sponsoring your trip, you know, sometimes there will be people that say, I want to support this doctor, I want to support this individual to go on that trip. Do not go on that trip unless you are ready to sow something. Is that as individuals, when we come on the mission field, we need to be ready to pour ourselves out. It doesn't mean that you can't go if you don't have a lot of resources. You can ask God to provide. But I really believe that God gives seed to the sower. And every single time I've been on a missions trip, there's always been opportunities that we never budgeted for. And it's so important that we come with that generous attitude. I remember we had one team, and I was so disappointed. We had this gentleman on the team, and he was, I would say he was rather wealthy. He didn't have any financial problems. He paid his own team trip. And during the trip, we had a real significant need come up. And the church had sent what they could, but the church wasn't able to send any more. for that immediate need. And I remember Pastor Jordan turned to the rest of the team and he said, we have to meet this need. This is something that we just need to do. And I want each of you to give what you can today. And I remember multiple people opened up their wallets, except for this one man that was actually a wealthy person. And he crossed his arms and he said, I've paid my trip fees. I'm not giving another cent. And I remember as a pastor, my heart broke because I thought he missed the purpose of why we came. We didn't come to serve. It wasn't your trip. The trip is there to serve the people that are on the ground that you've come to minister to. Coming with an attitude to serve, one of experiences that we had one time, and you'll find this if you say that you want to be an area that hosts people, you'll find that over time there's some people that don't always have the best motives, and you need wisdom and discernment. So I remember at one point there was a lot of international teams that were wanting to come to Asia, and a very large denomination from Canada approached our church. And they said, we want to send a missions team here, and we want you to take us to the orphanages that you work with, the foster homes that you work with. We want you to set up ministry opportunities, preaching to us, and we're going to come and preach at your church on a Sunday and serve. And so as we began to talk about the logistics, I began to ask, okay, well, what is your budget? And we began to explain to them, if you have a team, this is the cost for accommodation. If we, get just general accommodation, this would probably be the cost for food. And we said to them, since you're going to the orphanages and you're going to the foster homes, what are you going to do to serve them? And this leader of the denomination looked at me and he said, well, we're not coming with anything. And I said, I'm not taking you to come to this country, bring a group of young people, for me to serve you, to put you in hotels, to tour you around, if you're not ready to pour into the needs of the places that you are going to. And so this leader was absolutely shocked. He was like, well, why won't you take us? And I said, because you don't have the right heart. You're not coming here to serve these people. You're coming here because you want to be served. And you'll find sometimes, and this is one lesson that we've learned the hard way, is that there will be sometimes people that appear to have good intentions, but sometimes can even monetize mission. For this particular ministry leader, he had budgeted so that he would profit off the trips, but the places that he would visit, he would leave nothing behind. So I would say, as a medical ministry, and I know when you're starting from ground zero, sometimes we don't have a lot to start with, but we can start with heart. We can start with the heart to say, God, I'm coming to serve. I'm not coming to take. I'm coming to pour my heart, and I'm going to trust you, God, whether it's tickets you need to raise for, maybe it's money and food on the trip. And God, I'm going to believe for you that you're going to give us something that we can leave something lasting for the people that we have come to serve. Some of the dangers that we see sometimes are dangers of pride. Often ministry teams or mission groups will come into a place, especially in cross-cultural situations, and they'll come with a prideful attitude, thinking that they know the best. And I think Tim, I was listening to a session about an hour ago when he was talking about the importance of listening to the people on the ground. When you're going into a cross-cultural situation, you need to be humble and know that you're not the expert. The people that are the doctors on the ground, the hospitals that you're coming to serve in, the churches that will perhaps open doors for you to do this type of work, that we need to listen. What is it that they want? What is it that they really need? I've worked for in recent years for an international denominational and missions organization. And, sometimes the churches that we've worked with, they have this mentality that, they want to come and do something, but it's not what the church or that ministry or that country needs. And sometimes we can have this pride to say, okay, this is what we're going to do, and this is what I want to do, and I'm going to go home and take my pictures and show everybody what a great job I've done. It is so important to listen. It is so important to listen to the words of the people on the ground and not have that imperialistic mindset. You know, even among people that have returning to their home countries, I would say people that have lived in their country, left for a very long time and come back home, can even have those same imperialistic mindset to say, I know better than you. I've, you know, had a worldview different than you. And so I'm going to tell you how things should be done. We need to be humble. We need to listen. We need to come and serve. So the other thing that I've learned over time is never underestimate the importance of team training. So you can go back a slide. I think you're a little bit further ahead there. And so this is really important to understand. So when you're planning a team, when you're casting the vision as a group, so if you're saying now we're going to recruit doctors, we're going to recruit people to join us on our medical mission, never underestimate the importance of team training. You know, just because someone has lived internationally doesn't mean they're going to be a good team player. Missions trips, and I'll say this from a pastoral perspective, missions trips and medical missions, they have a way of bringing out the best in people and also bringing out the worst in people. And so if you're bringing in a team, I want to tell you that character is more important than skill. I don't care how skilled somebody is at what they do. If they don't have character, they're going to damage the people that they're coming to serve. And so when you're a leader gathering teams, there should be a process in how you decide who comes on the team and who doesn't. And I say that from experience, a failure when we didn't do that. I remember in particular, there was somebody on our team that we took one time when we were building a school. And, you know, we saw the red flags in this person. They had a hot temper. They would have outbursts of anger, but they were so skilled in construction. And I remember we were thinking, should they come? Should they not come? And we were like, you know, we really need this person on the team. We need their skills and we need their gifts. And I remember that trip, so much heartache and so much pain because we didn't listen to the voice of discernment in our own heart. We chose skill over character. And so I want to encourage you as a team leader, as you're gathering your team, it's okay if not everybody comes. Sometimes it's not the right season. It's not the right person to come on the team. And so when we want to serve not just in excellence of skill, but excellence in character. Some of the things to train your team in is to prepare them from the challenges they might see or experience. And this will really happen, especially if you're bringing people into very shocking situations. You know, myself, I remember one time I went on a trip to North Korea, and this was an aid trip where we were investigating projects that the organization that I was partnering, our church was partnering with, was going to do some projects, and they'd already done some, and so we were also doing a follow-up. I remember being on the trip. It was so hard to see how the people there, the oppression that they faced every single day. There was things that we saw on the trip that we couldn't talk about to anyone else, but I went back saying to God, this place is so dark and it needs you, Jesus. And I remember for weeks coming back, really struggling. It had done something to my mind, that oppression and being in that place. And I hadn't prepared myself actually for what I was about to see. And so, especially if you're taking people that maybe haven't had a cross-cultural experience, maybe haven't been seen severe poverty before, it's really important in your team training that you prepare people for what they're going to see. But also the reentry is sometimes when people have seen something in the mission field, they struggle with extreme guilt. They'll come back and say, you know, when they have a cupboard of food in their home, or when they have a roof over their head, when they saw people that were living in the streets and didn't have a roof over their head, they struggled with feeling guilt, feeling shame because of how they lived. And that's not how God wants us to be. God wants us to live our life with an open hand. And sometimes we'll see these experiences in other countries, and God shows us it because he wants us to have that compassion, like Tim has said. And God will send us sometimes just to sow a seed. Maybe you're just one person that will go and bring a small bit of light to that area, and God is going to send someone else. and he's going to send someone else, and he's going to send someone else to continue to water those seeds that you've planted. But it's important as a leader of a team that you prepare your team for that. You know, you can never, and I say this, I know a number of you have been studying overseas for many years. That cross-cultural return, you have to prepare yourself for, because when you've lived abroad, well, my husband and I, we spent 13 years in Asia. I want to tell you, when we moved back to our home country, we had the biggest culture shock, more than we did coming to Asia, because so much in our country had changed, the people's mindset, the morality. We came back to a country that we didn't know anymore. And many of you that have been overseas, you've been studying for many years, when you go back, you're going to have to readjust to your own culture. You're going to have culture shock. And even going with that, I want to encourage you to prepare yourself and to ask God to help you to see things the way He would like you to see it. Lastly, I'm going to wrap up really quickly because I know we want to have a Q&A. But I want to encourage you to plan for support staff. And so when you bring a medical missions team, I want to encourage you to not just have doctors and nurses, but you need administrators, you need prayer team members, you need photographers to document what's happening, and you need the evangelists, you need people with the fivefold ministry gifts, you need people that have just loving and caregiving, you need friendly people. And so don't be afraid to expand the pegs of your tent to invite more people. The more diverse of a team that you have, the more gifts that you bring to the table, the more you have that weight taken off, so that when your team comes together, like that first story that I told you, you have this ability to be able to respond to the spiritual needs that come your way. It's so important as you prepare for your team, as we talked about team training, to pray for your trip. Set the culture before you leave. So if you're doing team training, getting ready to go on a medical mission, include God in the planning process. Make prayer part of your planning and training meetings. And I would say this is enlist intercessors when you're on the ground to be prepared, praying for your team. When we've been on mission before, I want to tell you, things go wrong. And it's not just coincidental. I know one time we were building a school. We had done this container school and we had a crane there. We had an accident where the crane rolled down the hill, could have killed somebody. And yet God kept everybody safe on the project. Things go wrong, things happen. Never underestimate the importance of your prayer covering. So if you're going out as a team, do not go out. Ask your pastor, ask your mother, ask your grandmother, ask the prayer warriors in your church to pray for you, because you will encounter spiritual warfare. This is a spiritual work. It is not just a physical work. And so as you go out, make sure that you have that prayer covering. And when you're on the ground, I want to encourage you, whoever's leading your team, to set the priority each day by praying and doing devotions as a team. You know, on a medical trip, your day is so busy from morning to night. You're looking at needs. Don't plan God out, or don't make it so busy that you don't have room to include God in the process. Best medical trips I've been on, the best missions trips I've been on, are the ones that have prioritized and said, you know what, every day we're going to have a devotion, we're going to pray, and we're going to debrief and talk about what happened at the end of the day. The debrief on a trip, especially daily, you know, sometimes missions organizations will do a debrief a month or two later. There's things that are going to come up on your ministry trip. There's things that are going to go wrong. There's things where people are going to have their feelings hurt. There's things where people are going to see that's going to shake them. And you as a team leader, you need to be ready to help minister to those doctors, to minister to that support team, and help them work through those issues as they come up throughout the trip. And so, and lastly, you know, don't forget to pray for the miraculous. And I know this is something that Dr. Fala is very passionate about. You know, sometimes as for doctors and nurses and medical professionals, sometimes there's no answer to the need that we come across. There's some cases, and we know this, no matter what medical intervention is provided, some people just need a miracle. And we need to be ready to believe that God can not only use our skills, but He can use us to intervene in medical miracles when medical interventions can't be. And so I want to encourage you to have faith for that. I really want to thank you today for this opportunity to share with you. I hope some of my stories have brought encouragement to you and maybe tweak some questions. And I came really from a pastoral side today, so I'm sure it's made you think about things that you didn't think of before. But I would love to answer any questions that any of you have about bringing on a team with you on a medical mission.
Okay, thank you very much, Reverend Tetley, for sharing your story and also sharing with us on support. Okay.
Okay, thank you so much, Pastor Cyan, for coming, and thank you also for. I know it's quite late early morning, early morning, and she's up like it's not after 12 midnight. Like if I
That's
was the
okay.
one
I've done it to you lots of times, Dr. Bala. You've served with the church sometimes in the middle of the night, so you can get even anytime.
I've done couple of speaking like that where it's 2 a.m. or 1 a.m. and I know how it can be. So it's good having you and thank you so much. Yeah, I know we're also kind of dozing here now. Lunch is ready. Yeah. So and a question, don't carry the question because you want to go for lunch. Yeah. The food is
Maybe you have a
here. If you have the question, you want something to share, definitely let's do that. We gotta go right down there for lunch quickly. Yeah, we have a lot of food. Maybe you can go 2 rounds, 3 rounds. Yeah. Okay, Dr. Height. Yeah, you want to jump off for lunch as well, Dr. Height? You're welcome. Yeah, hands is up.
I'm going to get a quick flight to come over.
Okay.
Greetings, everyone. I hope I am audible enough. I want to thank Reverend for the inspiring delivery. And I think it's important that we get to understand these things. There are a lot of things she said. I've been involved with missions, and I've never thought of most of the things she said in planning. I was always thinking of the technical staff, and that now I got to know and understand that you need more than just a technical staff. You need support staff, and above all, you need character. And that is the underlying message I get from her today, that you need character. Because when I was in Ethiopia the last year back, there's this team that come from South Korea, and the head is very emotional. He shouts, he's impatient, and all the fellows, were feeding the feedback of his emotions and the aggressive attitude, but no one wanted to say it. So when we get down to talk, I'm going to say, these people came to help us, so you're going to discourage them. I said, no, let him understand that his attitude is killing the spirit of the mission. And when I brought it out, his supposed staff, like, that's how he is. He have good intention, and you just have to bear with him. I'm like, but yes, he may have good intention, but his emotion is driving us away from learning. And I think that those of us who are going into mission, into volunteerism, we need to consider this issue of attitude very seriously, because it can hamper the aim of your mission. It can give bad feedback. And I want to ask Reverend, I love mission, and let me confess to you, I also hate missions. I love missions because most of the times they solve the problem that we cannot solve locally. But I hate missions that come and with no intention of developing the human capacity of the local staff, so that over a period of time, they can take over and start being dependent, because you may not always have the sponsor to come. You may not always have the financial resources to come. But most of the missions that I've been involved with, I've been seeing, they only come want to do the work, and there is no time for training the local staff. So we become dependent upon them. When they are not available, we cannot do nothing. Where do you stand in the aspect of human capacity development in order to make you get chance to go to other areas? Because, for example, if you came to Liberia and you train me, okay, doing what you can do. After 2-3 trips, you won't have to come to Liberia again. You have to go to another country that really needs you again. But what do you stay in that aspect of making the local staff capable of doing what you can do so your mission can live short? You can just stay for overseas and get results and praise God, say, yes, God, thank you. I planted a seed and the seed have grown.
I totally agree with you. I think there's been huge shift, I would say, in the mindset of mission. And so I used the word earlier, imperialistic thinking. And I think a lot of, I'll say this as a white person, I think a lot of white missionaries have done great harm because they've come in with this imperialistic attitude. We know better, we're the experts. We're going to come in and do the work for you, right? And I think what you're saying, Dr. Hart, is so important. I think the future of mission is really empowering the locals, because if you, like you said, if people that are staying every single day, if you go into a local hospital and you're partnering with them to bring in some expertise that they don't have, yes, you can do surgeries that maybe they can't do. But if you can train their doctors, if you can help them improve their skills, then that can live beyond the team. So I think that is absolutely the right attitude. And I think as a team, I think you're going to be formulating what you're going to do and what you're not going to do as mission, right? And so if you're going to be gathering together as a fellowship to say we're going on missions together, I think these are some of the principles you have to put down on paper so that you're not just going in and doing the work, but like you said, you're leaving a legacy behind. So that's excellent.
Okay, if there is no other person who want to ask, then let me take a personal question to you or personal request. I don't know. Now, I'm a young cardiothoracic surgeon from Liberia. Maybe in the next few hours, I will be giving you feedback of my work and my testimony, how far God has brought me. Well, we will lead missions for cardiac surgery in Liberia. Liberia have never had a cardiac surgeon before. There are over 40 plus thousand children currently living with heart disease in Liberia. And we as doctors only watch them and until they die and the parents go into cycle of trauma. And we are thinking on, I was back home for the last 9 months and I tried to engage the government. We have a project proposal written that will break it down into the minimum cost, like 150,000 to train the first 5 persons that in the next 2 years, we can start surgery. But African politics is not as healthy for the people. So people play politics for 9 years. 9 months, I could not get anything better. I could not practice. So I had to come back to Ethiopia to continue practicing so I cannot lose my skill. So we'll be looking up to you with the vast experience you have in admissions and see in the next 2-3 years, what can we do for the children of Liberia that are living and dying each day with heart diseases. We appreciate, if you can work with us over the next 2, 3, 4 years. Heart surgery setting up is not an easy thing. So we're not expecting it to happen in the next 2 years, but we'll say 3, 4 years, we expect to see you and your team back to Liberia. This time, not post-war, this time for the children with heart diseases, how we can help them and give them hope to live again. Thank you for your presentation, and I appreciate your knowledge given to us.
Amen. Well, I look forward, God willing, that we'll join and support you and your team. God bless you. Thank you. I know all of you are really hungry, so if there's, I'll pass it back over to Dr. Bala.
Yeah. Thank you. Any other person? I'm not sure anybody in the in-person want to ask question because yeah, but any question? I don't see any hands up online. And here we already have our lunch, so we're gonna pray for lunch quickly, and we'll be asking you to join us online. Yeah, but great. Thank you so much, Pastor Soyan, for the sharing, and we're gonna be back soon. We'll be hearing amazing testimony from Brazil. My Brazilian brother is already in the house and ready. Welcome, Pastor Leo. Yeah. So thank you so much. And so a couple of things, please. We're gonna let Pastor Soyan go. Yeah, couple of things in here. We're going down on the 17th floor for lunch. There's a catering is there. The food is already there. So just take one of the bottle of your water here. Then because we got the food order coming in. So just take one. You get 2 bottles there. If you haven't drunk, or you can take one. If you have drunk the 2, no problem. We'll get you another one. Yeah. So take your bottle of water with you, so that we go downstairs on the 17th floor and eat. Don't worry. No need for pass. Like I have 28 persons signed up for in person, so I was preparing for 35. And I think I see less than 25 years. So you can take 2 bowls. So nobody will even ask you for pass, just eat. Yeah, so we go down now. We will be coming back by 12:45. Yeah, we'll be coming back by 1:45. And so latest how we adjust it, but I know Pastor Leo probably we can get it back. The latest 2 we start. 2 on dot we start. Yeah, so I don't want to rush you so fast so that you say you enjoy your lunch. Yeah, so they got lunch, 17th floor. So you don't you can use the elevator if you want, but I think you can take an exercise and use the step. Yeah, so we're gonna be having lunch. For those of you joining us online, we want to say keep tone. We're coming back soon. We want to get some energy, and we'll be right back with you very soon in 45 minutes. We're catching some food. And so if you I know many of you is AM. If you go by to take a nap, don't oversleep and don't come. So just remain here. We'll be right back. Yeah, and we want to encourage you to keep following. At the end, we're going to have feedback. And we also actually following the attendance online. We're not going to give a certificate of participation to those who are attending online. So yeah, we got more than 40 people signed up for online. Yeah, so we got your certificate ready. Those of you in person, your certificate is already ready, signed, we present it here. You take some picture, Yeah. Yeah, we need to pray for lunch, right? Father, bless the food in Jesus' name. Amen. Amen. He talks so much on the
That's how food prayers can go. When the food is really needed, the prayer is short.
I want to test the DVD. Yeah, okay, sure.